Welcome, everyone. I'm Dr. Goyal. I'm one of the professors of Otolaryngology and head and neck surgery at Penn State Milton Hershey Medical Center. And we want to thank you for joining us today for this holiday cooking webinar tailored specifically for head and neck cancer patients and survivors. Together, we're going to explore how to make delicious, festive dishes that are both flavorful and gentle on the palate, making them easy to chew and swallow. Whether you're navigating dietary restrictions or recovering from surgery, this session is for you. Our goals for this session are to go over the nutritional requirements and the key needs for those with head and neck cancer, including tips for maintaining caloric intake, protein levels, and modifying textures. We'll also go over different modification techniques to create meals for textures suited to specific dietary needs. And additionally, we'll talk about strategies to elevate the taste and appeal of soft, easy-to-eat meals. Throughout the webinar, we welcome questions. They can be answered either via the chat or Q&A, or through the Q&A box throughout the webinar. I'd like to start by introducing our panelists. We have our Alliance Ambassador, Kris Molnar. She was diagnosed with tonsil cancer in 2006 and navigated through months of challenging treatments. Post-treatments, Kris finds ways each day to embrace life by photographing picturesque landscapes of her West Virginia home, spending time with dear friends and family, and spreading good cheer to all she meets. As a farm owner in Wheeling, West Virginia, Kris understands the importance of cultivating and maintaining a healthy diet. I'd like to also introduce Janelle McLeod, a clinical dietitian at Penn State, who has nearly 30 years of experience in medical nutritional therapy. She has dedicated much of her career to educating patients in outpatient settings, both individually and in groups. Over the past 8 years, Janelle has specifically specialized in working with oncology patients and is a strong advocate for nourishing the body with healthy foods. Lastly, I'd like to introduce Paige Rizzuto, who is a culinary dietitian at the Boston Medical Center and Rewire Health. Paige is a culinary dietitian with experience leading virtual culinary medicine classes, including specialized sessions for cancer support groups. Her focus in these classes is to build a supportive community while teaching practical nutrition and cooking skills tailored to the unique needs of cancer patients. This approach helps foster connection and well-being throughout treatment and recovery. So welcome to all our panelists, and I hope for a good show, and I'll be cooking along as well.
Hi, everyone. So excited to have you all with us. We're going to go ahead and kick off the recipe by preparing our butternut squash. So I know a couple of us are cooking along with us. If at any moment you have any questions, please feel free to throw them in the chat. I will kind of be skipping ahead in some parts of the recipe for the sake of time, but please, please, please ask questions if you need assistance while preparing the recipe. While I prepare the recipe, we're going to talk a little bit about some culinary techniques, some nutrition, and I'm going to be cooking along with Dr. Goyal and my friend Kris. And as well, we have our oncology expert, Janelle. So to kick off the recipe, let's go ahead and start cutting our butternut squash.
Great question from the group. Can we just go over what the title of this recipe is? What are we making today?
Yeah, absolutely. We are making a butternut squash soup. So we're really leaning into those fall flavors and really leaning into the seasonal element. Butternut squash really pops up a lot this time of year. So this is a really simple recipe that's got lots of good nutrition. And it's very warm and comforting, and we can really customize it to our own palate. We have the recipe up there on the screen. For reference, super simple. Perfect. All right. So I'll go ahead and show you all a cool trick that I like to use when I cut butternut squash. This type of vegetable has a really hard, rigid outer coating, and it can sometimes make it difficult to cut. Whether or not you're just not feeling great or just in general, it's a tough vegetable to cut. So some ways to kind of mitigate how hard that is for us to really handle is to really use some rolling techniques here. So when we cut the squash, we can kind of glide the knife back and forth as we rock the squash. And this will really help us not have to push so hard through this tough outer layer. Rocking it gently. Before I started cutting my squash, I did wash it with some water and I dried it since we are going to be roasting with the skin on. Perfect. So just some quick knife safety here. When you're handling a chef's knife, any knife in general, it's really important to have a strong. And for those of us who might just grab a knife and not even think about it, this could be a different way of holding it, and it might feel challenging at first, but once you start doing it, it'll become second nature. A really great way to hold your knife so that you have good support is to pinch the spine and roll your fingers. Really nice. We have good control here. I see a lot of folks do this. I'm guilty of it sometimes. It's not always the safest because you can see how wiggly my blade is. You just want to pinch and roll. We also want to be mindful of what our guide hand is doing. So our guide hand, we want to be mindful of holding down whatever we're cutting, but also not getting too close to our fingers, right? So sometimes when I'm being careless, I might get too close, getting close to my fingers. So a great way to really hold on to whatever you're cutting and protect your fingers is to kind of keep them curved. We call this the bear claw or the eagle claw, whatever you prefer. And it's really nice because when the knife gets close, we're not going to chop off the tip of our finger. It took me a while to really get this as a second nature. So if you're holding the knife like this and you think it feels weird, just keep practicing. It'll start to feel better as you realize what better control over the knife you have. We're going to go ahead and cut the bowl from the stem. Again, you can see I'm rocking my squash here, holding on tight to my knife. Perfect. This recipe calls for about a 3-pound squash or roughly 4 cups. So depending on the size of the squash, you might need to cut 2, but squashes come in different sizes. So you can really kind of just try to pick the correct one, or you could even, if you wanted to skip this step, there is frozen pre-cut squash, which you can probably find in the grocery store or even in the fresh deli section. We're going to go ahead and cut the bottom half of the squash in half. Again, kind of keeping my claw here. And as I'm cutting, let's talk a little bit about the benefits of butternut squash. And I want to ask my friend Janelle if maybe she can share some good nutrition about butternut squash and what it offers to us.
Absolutely. So generally, a diet high in fruits and vegetables can help with, lowering blood pressure, reducing risk of heart disease and stroke, and preventing some types of cancers. But specifically, any kind of squash contain a lot of good, healthy vitamins and minerals. Vitamin C as an antioxidant for immune health, magnesium, potassium. There's B6, beta carotene with that nice orange color. That's where the beta carotene or vitamin A. Also fiber to help keep your bowels moving and help with blood sugar regulation. So squash is an excellent source of vitamins and minerals and fiber.
Awesome. Thank you so much, Janelle, for sharing that. We're going to go ahead and cut off the edge of our squash here just to make it easier for preparation. As I do that, I wanted to ask Kris, do you have a favorite seasonal vegetable that's in right now? I know we're doing squash, but do you have a vegetable you look forward to cooking this time of year?
I've learned to love vegetables, let's put it that way. But spaghetti squash is definitely my favorite. We have it regularly. It's our daughter's birthday meal, and we do it all sorts of different ways.
That's awesome. Now, do you think that rocking knife tip would really help cut the butternut squash? Because that's a tough squash to cut as well.
What I do is I as we have talked before, I put it in the microwave to soften it a little bit, especially if people are just coming back from treatment. As you were talking, they might be weak. So it would help if it was a little softer to start with. You have to kind of let it sit so it's not super hot, but I find that the easiest way to do it.
Absolutely. And because you brought that up again, and you actually shared that with me before when we spoke, I want to go ahead and put these in the microwave to just show everyone how much this can make a difference when you're trying to peel. I know for this recipe, we're going to roast and scoop out of this, but we pop these in the microwave for 30 seconds and show everyone how much easier it is to peel. I want to thank Kris for sharing that with me because that was something that we spoke about, and it reminded me how awesome that is a tip to have because squash has such that hard, rigid skin. I usually do about 30 seconds. And the benefit of really microwaving the squash is that it's going to soften the skin and that flesh underneath. So that way, when we take our peeler here, that outer skin is more loose and less rigid. So it's a lot more pliable. I know if I would just try to show you doing this, I'm really pushing down hard on this squash, which if you have a smaller squash might not seem too much of a big feat, but if you have a big squash, that's a lot to peel. So that's why with this recipe, I'm going to show you 2 ways to. We'll go ahead and leave these guys in their skin, and we'll peel these. As Kris mentioned,
Does it feel like it helped?
yes, I feel it feels softer already. I can even dent it with my nail a little bit. I think 30 seconds to a minute is a really good sweet spot before it gets too hot. You can see how much it's just going to glide right off.
Paige, is it necessary to peel the squash for this recipe?
I'm sorry, Dr. Goyal, what was that question?
Yeah, do we need to peel the squash for this recipe, or could you keep the skin on as well?
You can keep the skin on. You definitely can, and it makes it a lot easier. But if you're someone who, and I'll show you, I have some squash already roasted, and how you have to scoop it out of the outer shell. It can be either way. It can kind of be one of those things, whether you'd rather deal with it when it's mushy or deal with it when it's a little bit hard.
I think it might be easier the way you're doing it now, because I did it the other way. It wasn't so easy.
Exactly. And I agree with you there, especially trying to scoop this cooked flesh out of this harder shell. I think sometimes it becomes more of a mess than I want to handle. So personally for this recipe, I think what I have found that works best is to leave these guys in their outer coating and to skin these just to make my life a bit easier. And again, I don't find this as tiresome as this with this funky shape. It's a little bit more effort. You can see how easily this glides. Now, if you are going to roast it in all of its skin, that is totally fine. And if you try to scoop it out once it's cooked and it's not all coming off, that's okay too. When we roast it, it will make the flesh a little softer. It's not going to necessarily, fall apart and be as soft and tender as the flesh, but it's okay. If you're someone who doesn't really mind that texture, you could throw it in the blender like that as well. I know I have someone in my family who's very particular about textures and doesn't want anything like that. So I would probably try to make sure I get all of it, but it's totally up to you.
Might be a little harder to swallow as well if it has that texture.
Mm-hmm.
Exactly. And those are really important things to consider when you're preparing. I know as we get to the portion where we're going to blend it, there's different ways to approach it with the texture to modify it for whatever your needs are. That's a great.
It seemed to me that when I cooked it with the skin on, I wasted a lot because it was difficult to scrape it from the skin.
I agree. I felt the same way. And I thought, am I doing something wrong? But it's just so difficult to fly it out of that fleshy skin. We're going to add a little bit of oil here. The recipe calls for extra virgin olive oil. That's totally fine. You can use that. In my kitchen, I just tend to use avocado oil. Just kind of what my go-to is. Either oil is fine. I'm also going to add a little bit of pepper, which I can't say that too loud because my dog's name is Pepper, and if she hears me say her. Some fresh salt. I am to just save me some hand washing time. I'm going to throw on some gloves and massage in my oil and salt on this squash here. If they left these in larger chunks, they're going to need some time to really roast in the oven, probably, 30 to 45 minutes. If you are trying to do this in a quicker amount of time, you can go ahead and cut your slices smaller. Again, if you leave the skin on, I'll show you, it's going to be a little trickier to peel out of the skin, but that's quite all right. I'm going to roast it with the skin side like this.
Paige, at the end, do you want it sort of mushy? Is that how the consistency that you want once it's fully cooked?
Absolutely. Mushy, tender, squishy, whatever word fits the description. Absolutely. I'm going to pop this in the oven. We're going to pretend as if It is all finished and roasted, but I will actually put this in the oven because by the time we're all done making this, I can show you what this looks like when we leave it in larger chunks. Right. Awesome. How are you doing, Dr. Goyal? How are you doing, Kris?
Good.
Good?
I have mine ready to cut. Are you ready to go, Dr. Goya? Or is
I got all my pieces. We're getting them on in the oven right now.
Awesome, awesome. All right. And again, for those of you cooking along with us, I know I kind of moved forward rather quickly. We kind of roasting time, but we have some good stuff to get through. So let's talk a little bit about what my squash looks like now that it's roasted. I'm going to throw on some gloves again because this part gets messy. I have my beautiful roasted squash here, and you can see here's a piece of what it looked like raw, and here's a piece of what it looked like. You can tell it definitely darkened in color. As Kris mentioned, it's squishy, mushy, maybe not the best words if you think it's appetizing. I usually go with tender. Something to squeeze, right?
That's safe, isn't it?
Yes. Yeah, squishy mushy is fine too. I think sometimes strawberries or berries when they're overripe are squishy and mushy, but definitely this piece too. I think this one would be what we would call squishy. You can see here that some of these pieces got this nice brown color on them. And that's one of the benefits of roasting your vegetables. So when you roast something, dry heat method, and usually our temperature in our oven is around 350 to 450. And when we have it at that temperature, something magical happens. The chemistry, right? It's called the Maillard reaction, which is what happens to this when it turns brown. It's caramelizing the natural sugars in the squash. And it's going to result in some really complex flavor. It's going to make it sweeter and nuttier and really yield this nice golden brown flavor or color, I'm sorry, and flavor. I think when I look at this, I can just like taste how it would be in my mouth. It just makes me think of like smoky. Right? Now, when you're arranging your butternut squash on your sheet pan, if you're cutting them up into tinier pieces like this, you can see these are pretty thin, you might run into the issue of crowding on your pan. And when you're sheet, you want to be mindful to not overcrowd your pan because then your squash, as they're in the oven and roasting, will start to evaporate all the moisture and they'll steam each other. And steaming is an okay method to use. It's a really great method that retains a lot of nutrients when we cook vegetables. But in this scenario, we want to avoid steaming because we want to really lean in on these nice caramelized flavors, right? Like when you think of steak, or even when you take broccoli and you roast it in the oven, it gets that really nice browning that really, I think, associates more flavor. So really delicious way to think about how that's going to taste. Now, as Kris mentioned, it's kind of a pain to get this out of the rind, right? You can go ahead and just squish it out with your fingers. And like she said, I feel like I'm wasting a lot. So I'm going to try to go in with a spoon and do the best that I can. It's squishy and it's mushy, so it's definitely going to be a little bit of a tricky mess. Now, leaving it in larger chunks might make it easier, but again, I still do feel like I'm wasting some of the squash. This last little chunk. And the rest of these, oh, look, we have one more. He snuck away from me. And when I did this the first time I made this recipe, I made such a mess of my hands. So I learned if I wear gloves, and I don't make as big of a mess that requires some intense hand washing.
Are there specific spices, Kris, maybe you can answer this question. Are there specific spices that you found kind of burned your tongue more or were harder to tolerate, especially kind of, when you were immediately post-treatment?
I have, after 18 years, I still can't do any hot spices. Everything that particular taste it's exacerbated for some reason. So I love rosemary and I love basil. And I chose rosemary and thyme and a bottled thing that I like called Pick a Pepper that's from mango juice. It's fermented mango. So I put that, that's what I decided.
That sounds really good.
That does sound delicious.
Dr. Goya, what would you like in yours? What flavor did you choose?
So I chose cinnamon. So I have cinnamon. I did add a little bit of garlic. So I definitely went with more savory routes. But, you know, I know for some of my patients, cinnamon can cause a lot of burning on their tongue also. So I was curious. That's why I was curious. But
It's
the
more
rosemary is great.
paprika, chili pepper, those kind of
Yeah.
things.
Yeah.
Great question to ask, because now we're at the point at which we added our squash that was cold to our blender. If we don't have a blender, no worries. We can use a hand mixer, an immersion blender. If you even have a food processor, whatever works. If you don't have any of those and you really just want to go at it with a fork or a masher, you definitely can. But this is where you get to add your own twist on things. Like Kris said, spicy is not her thing. So you can really lean into whatever flavors you prefer, because butternut squash is one of those cool vegetables that can go sweet or savory. And because I'm, feeling the warm and cozy vibes for my food today, because it is very cold where I'm at, I'm going to go with some warming spice. Like Dr. Goyal said, sometimes cinnamon is a little difficult for folks to tolerate. I'm going to do a blend of cinnamon, but I'm also going to do some nutmeg, and I'm going to do some cloves. You could, not use any of those, and you could maybe do something like coriander. You could do something like, if you love like a pumpkin pie spice, that's just a little bit of those to add some flavor. You could. You're going to go a savory route. You could do some things like sage. You could do rosemary. You could do fresh herbs and spices. That's the beauty of something like this, is that it could be sweet or savory. So some holiday herbs that I would go for, just because, it's the week of Thanksgiving and just the holiday feeling, I would probably go with the ground sage and some rosemary. And the best part about herbs is that they're really delicate and they have a lighter flavor. And they come from the leaves of a plant, whereas spices tend to be part of the plant, and they come from things like roots, the bark, seed, and the flowers. And for my holiday spice, I'm going to do cinnamon, nutmeg, and clove.
Some of our guests, Paige, actually said they add carrots and apples, which would make a great flavor with the soup, so that you wouldn't necessarily have to use the spices.
Exactly. And that's a really great point, that sometimes you don't even need to add those if maybe that's something right now your taste and your smell is not, at what it could be. Leaning in on other things that you love to kind of complement the butternut squash. Exactly. I think that's a great point. So I added my warming spices here, and now we are going to add some broth. I have about 3 cups of chicken broth. If you want to make this a vegetarian recipe, you could do something like coconut milk. You could do something like, you do vegetable broth. You could honestly even do water if you're not quite sure if any of those flavors are going to work well for you.
And bone broth can add a little bit more protein to things if you add bone broth versus just regular broth.
Absolutely. And Janelle, maybe you can tell us some other things that we could add to really boost the protein content of this food.
Sure. So anything that really can be blended that's going to have protein in it, we can add Greek yogurt. You could add nuts or nut butters. Sounds kind of strange, but there are a lot of nuts that are creamy when you blend them. Beans or legumes, so you can use white beans that would actually give it a good texture, but also add a little bit more fiber and protein. You can, I know we're going to be using tofu, so we'll talk about soy. You can add powdered dry milk, which just will mix right into things and add about 8 grams of protein per quarter cup. And you can also add protein powders. So I would get the unflavored version because you don't want any kind of strange flavors going into your soup. but there are certain unflavored protein powders that you can cook with. Others that you can't. They might get a little thick, gummy, and gooey. So you do have to look for the ones on their label that say that you can cook with them.
Hey, Janelle, what do you think about adding maybe half and half for the fat and the protein?
You
Because-
absolutely could do that. Yeah, the half and half would be fine. If I want to wear my cardiac hat for heart health, half and half is probably not the best option. But you could also use whole milk, which has a little bit less fat than the half and half. But if you're just trying to get calories in, because a lot of times you need that extra calories if you're losing weight, especially when you're going through treatments, it's important to not worry about these cardiac issues. So if you have heart healthy, been told you need to follow heart healthy guidelines in the past, or have high cholesterol, I usually kind of throw those to the side and add, just like you said, Kris, just add the half and half, or you can add coconut milk, which gives a lot of nutrition as well, or using whole milk works just as well.
I've not used almond milk in anything like this, but it doesn't seem to me that would work, but I'm not sure.
It would work. It just doesn't have a lot of calories, and it doesn't have like that nice, super thick flavor or texture that you would like.
The creaminess of this to me would be an important component.
Yes. And you can also, like, once the soup is done, you can always add like dollops of sour cream or Greek yogurt on top as well. I've done that in the past and stir it up really nicely, and it makes it provides a lot of extra nutrition for just, as a garnish.
Paige, what would you think about chives or chopped shallots on top of this with the Greek yogurt or sour cream? Do you think that would make it even better? I don't know.
I think it would be delicious. And I think for those out there who might struggle a little bit with some spice, leaning in on caramelizing them, cooking them low and slow on a skillet, get that sweeter caramely flavor can reduce that bite of something like or an onion.
There's nothing better than a caramelized onion to me.
I think it would be delicious as like a little topping with maybe some roasted pumpkin seeds and a little bit of Greek yogurt. Even if you do a warming spices in the soup, top it with something savory.
Or toasted pine nuts.
Yes.
That would be great.
Delicious. I don't think the almond milk would be a bad idea, but like Janelle said, it's not going to add that extra calories or nutrition. So that might be something someone would consider. I'd love to blend this in half and half. I am a big dairy fan, but like Janelle said, on our cardiac hat, that might not be the best choice with all of those saturated fats. I'm just going to backtrack a little bit. While we were chatting here, I went ahead and I added my silken tofu. So we have our warming spices, our roasted butternut squash, our silken tofu, and our broth here. And just a little bit about tofu. What exactly is tofu, right? So it's coagulated soy milk that is then pressed into a block, okay? So it is a soy product. And there are some myths out there about soy products. What I'll say about what we're doing here is it is a great way to add some protein and some calcium to this meal, and it's also going to add some creaminess. The difference between something like silken tofu and something like firm or extra tofu is really moisture content. If you're going to do something that's going to involve blending, I always lean in on silken tofu because it's going to blend really well because it has that high water content. For something like extra firm, they really squeezed out the water before they packaged it up. So it's really great for frying and stir fries of that nature. Tofu is really nice because it takes on whatever flavor that you put it in, right? In this case, because it's just raw tofu and we're blending it, we're going to put our soup in a pot and we're going to let it simmer to kind of tone down that tofu flavor and really let everything else shine. I did want to ask Janelle, maybe she can speak to us a little bit about those tofu myths that exist out there with cancer. And I'm going to mute my audio while I blend the soup because no one needs to hear the blender. And Janelle can.
Sounds good. So there are lots of myths about eating soy and the concern for especially breast cancer because of what people hear as the term estrogens, or what we call phytoestrogens. So phytoestrogens are actually a plant estrogen, and they there are isoflavones in soy, and they look sort of like estrogen. And but that chemical structure, while it may look similar to estrogen found in a woman's body, it's not the same kind of estrogen. So soy foods actually do not contain estrogen. And those isoflavones have actually been shown to have some cancer fighting benefits. So these studies have been done, and it has been shown that people who eat soy, about even up to 2 to 3 servings a day of soy, may actually have some protective benefits for cancers, for breast cancer specifically. So the bottom line is you can feel confident having tofu in your foods and in your daily routine. But if you choose not to eat soy, that's also fine as well.
I love that. Everything in moderation, right? I think that's
Exactly.
the best part about nutrition is that everything can fit and everything can be a healthy part of our diet. So here is, after about 15 seconds of blending, we can see it blended really well. That's what the mushy, squishy, tender squash comes into play here. It's not too much effort to blend it up. I have my stock pot here, and I have it turned on. I'm getting the heat up, and this is where we're gonna simmer our soup.
It looks delicious. I'm getting hungry.
Love the color.
All right, absolutely. I know where I'm at. The leaves are officially all off the trees, but this just reminds me of, those warm fall days where it's not too cold, not too warm, and the leaves are so beautiful and vibrant. Now, Kris, I wanted to ask you, what's your favorite kind of soup?
I have multiple favorites. I love mushroom soup, homemade mushroom soup. I love gazpacho and potato soup.
Ooh, that would be a delicious, perfect, warm and cozy soup to have.
For today.
Oh, that sounds delicious. I'm going to add that on my list. Do you like to top it with anything special?
Well, little tiny bacon bits on the potatoes. Sour cream and chives on the gazpacho. And on the onion soup, I just like it. I mean, I do like onion soup too. I forgot about that. On the mushroom soup, I like it just as it is.
Yeah. Sometimes the toppings are the fun part of soup, but even when the soup is perfect, it doesn't need toppings.
Sometimes I'll drizzle like olive oil on top of some soups, though.
That's some nice flavor. I love that. Now, I know you're cooking along with me, and you're doing a great job today. I want to thank you so much for cooking with me. I wanted to ask you, do you have a cooking strategy you'd like to share with everyone that maybe worked for you while you were going through treatment?
When I came back from treatment, 2 months, I pretty much ate the same thing every day because it was all I could tolerate. We made milkshakes out of Haagen-Dazs Dulce de Leche because it had tons of fat. Added an egg. Sometimes we added peanut butter. If I had liked bananas, we would have added bananas. But that I ate milkshakes based upon that every day until I could swallow again.
Yeah. How was your appetite during that time?
I didn't have any.
Was eating a struggle?
In fact, I eat today because I have to. I'm seldom hungry, but I eat because I know I have to sustain myself. It's not like it's a fun thing anymore, but we make the best of it.
How about your tastes? Have your tastes come back?
My sweet taste was really the first one that recovered, which I understand is not the case for most people. I taste some things. My mouth is still very, very dry, so I have to be careful about what I eat. Meat's not necessarily the best thing unless they're ground meat. For some reason, I can eat lamb chops, and I don't know why. And I love lamb chops.
So basically what happens is after treatment, your tastes may change and you have to work on trying other foods that may work for you better.
Right. For me, what's ended up happening is fruits do not taste so great to me, but vegetables taste delectable, and beans. So I eat a lot of that. I eat a lot of Greek yogurt. Just the other day, I figured out a recipe to make egg bites, and with eggs and cottage cheese, and then put my favorite cheese in there. My first attempt, the muffin tin, in spite of how much Pam I put in there, it stuck so badly. So I bought some of those little silicone things, hoping that it would work better.
Great idea.
That is a great idea. I was going to say, no matter what I do, they always stick. So I was going to say the silicone might be the best route.
Mm-hmm.
I've never used it. Does that help?
I think it does, but
well, we'll see what happens.
yeah. Sometimes those eggs, they're quite a binder. They'll bind to anything. They are.
So imagine what they do inside your body if that's the case.
It's good protein though.
Oh,
Yes.
yeah.
It's good protein.
Right, so we have some small bubbles popping up here. It might be a little hard for us to see, but what we're trying to do right now is simmer our soup. And I think a good way for someone to visualize what a simmer is if you've ever cracked a can of soda, pop, whatever you call it, and you see those tiny bubbles, that's something that we like to look at for a simmer, right? Those little tiny bubbles kind of popping through. My Pepsi bubbles, right? Now, a boil is something with bigger bubbles, and I think that the bubbles get bigger and they really pop and they're more aggressive. So as we simmer this soup, again, you could just be done. You don't even need to simmer it, but I like to really allow the flavors to absorb, and applying them under heat will let the moisture content reduce, and it's going to make a thicker soup, but it's going to really help those flavors shine through. And I wanted to ask Janelle if maybe she could talk to us a little bit about being mindful of consistencies, whether you're in treatment or post-treatment, or how we want that to look.
So yes, during treatment, if there's any kind of swallowing difficulties, I would hope or expect that you would go see a speech therapist who can do a swallowing evaluation. There's many textures are difficult to tolerate. Ones that are crumbly or dry, they may hurt the mouth for swallowing. They also can fall apart, and then you can't swallow very well. So sometimes things that kind of keep a single consistency. So if you think about like mashed potatoes or pudding, those types of textures tend to, form what we call a bolus, and that helps people swallow better. There's different things that you can use in soups and things like that to help thicken things up. There certainly are, you could use cornstarch, but there's also special powders called thicket or thicken up that you can use. You can buy them online, and you can use those to help keep things a little bit thicker. Very thin liquids sometimes go too quickly, and your mouth may not be, or your throat, your swallowing function may not be fast enough to hold them, and then you can get the liquid down into your lungs where it's not supposed to be, and that can cause a pneumonia, which you certainly don't want. So there's a lot of different tricks other than just those powders. You could certainly add beans, like the cannelloni beans or navy beans and blend those things up. You can add certain like more sour cream. You can add yogurts. Those can actually help thicken things as well.
Thank you, Janelle. I didn't think about cannellini beans. I think that would be a really nice thing to add into this to add some more
It sure would.
That's a great idea. I would probably, if I were going to add something like that, do it in the portion when I was blending to blend it in nice. You're using canned beans, then perfect. They're already hydrated and ready to go. And next time I make this, I'm going to try it with beans. That's a great idea.
You might have to add a little bit more spices, though, I would think, because that might like dilute your flavor.
That is true. Maybe even cut in half and do the beans because we're going to have another source of like creaminess and protein and all of that. But I think just kind of going off of Janelle, what Janelle was saying and what I have with me at the moment, if I wanted to thin this out, add some more broth, right? If you want to thicken it up, you can just let it reduce more and more. So if you know in the shorthand you're making this and you don't have those things available, you kind of work with what you have if you need to. But again, always work with your dietitian or your healthcare provider to decide what type of texture is appropriate for you.
Oh, I have another someone in of our guests. Something I didn't even think about, adding mashed potato flakes to things to thicken things up. What a great idea.
That is a good idea.
Great idea. Wow.
Oh, and someone said polenta as well. Okay. I love this out of the box thinking. This is great.
Flakes is actually so smart because you can just add it into this. It'll hydrate and thicken it right up. And
Yeah.
items, right? I think that would be a really nice compliment.
Yeah,
Could you use it as a sauce over like risotto or something like this, the soup that you're making?
That's a great question. I honestly think if you reduce it down a little bit more, it would be an amazing. Even like if you wanted to melt some cheese in this, and
Ooh.
Always cheese.
A smoked Gouda.
Mm-hmm.
great too, because say, you know, you need something to be a little bit softer, you can make it more of a loose sauce with, you know, some noodles floating around. It's almost putting it like a gravy. Sometimes mac and cheese can be really dry, but you can play with it because this originally is coming out a lot thinner and more liquidy versus viscous. Yeah, that's a great
Hey,
idea.
Janelle, when you are talking to people as they leave treatment, what are the best tips that you can give them to help them try to figure out how to fit their lives into what they can eat at that time?
Oh, that's tough. Everyone's certainly different, as you can imagine. I actually tell everyone to eat what works. So, you know, if you, just like you had said, you stuck with smoothies pretty much for the first several weeks. That is one of the biggest tips I would tell everybody is find something that works for you. So if you have to have just high calorie, high protein smoothies, you can add things to that to give you more nutrition. You can blend up spinach in it and carrots in it and beans in it to give more nutrition in that drink. While still getting, you know, getting fiber. So it doesn't have to be those disgusting, sometimes, or I call them disgusting, but the pre-made drinks, some people like them, like, but the protein
Different
supplements.
brands taste differently though, I think.
Exactly. So I usually say just eat what works. And as you're going through, you know, the time frame after, add new things in. Don't be afraid to add new things as you're going, you know, past or post treatment, even during treatment. Try new things that you didn't like before. Try them anyway, because you might like them. Tastes change. I also tell them to add more seasoning. So if something doesn't taste salty to you anymore, you can add more salt. This is not the time to be restricting anything. If you need more sweet flavor, add sugar or honey or syrup or maple syrup, that kind of thing. So that's a really good point. Everyone is very different. So I basically tell them to just keep trying and eat what works for them.
Janelle, there's a question in the chat here that I think may be a good segue. So are there specific types of foods that you recommend patients not eat, as it relates to kind of their cancer diagnosis. So Terry mentioned, dairy may not be recommended for patients who have prostate cancer because it could cause additional inflammation. So do you tell patients, hey, try to avoid X, Y, and Z foods with your diagnosis or recent treatment?
So that's a really good question as well. If they can, I try to encourage an anti-inflammatory diet because cancer is inflammatory. So I do encourage as much of the anti-inflammatory foods as possible. So that would be certainly your fruits and your vegetables and your whole grains, your omega-3 fatty acids like your fatty fish. But the opposite, the inflammatory foods would be things that are processed and cured. So things like that are very salty, ham, sausage, bacon, anything that has extra sugar added to it is more inflammatory versus just the natural sugars like from fruits and whatnot. So I do encourage more anti-inflammatory. However, during treatment, again, I kind of say throw that out the door and do what works.
Yeah, I think it's a great point. The one thing that I say to patients whenever I see them is I just want to see weight gain.
Mm-hmm.
Which
Stability.
is such a hard thing to do.
100%, 100%. So I appreciate that. There's another question in the chat that I think I'd be interested in, Kris, maybe your thoughts about this. Is it something where you can make a normal meal and then just throw it in the blender and puree it for yourself? Is that something that's viable? Is that something that works for you?
Absolutely not.
Yeah.
No.
Meg said the same thing here. She said she tried it and it did not really work.
Yeah.
So
you can puree some foods.
Yeah.
There
So what
reminds
tips do you
me
got
of
there?
baby food, the jar of baby food.
But you got to season that jar of baby food, right?
That's right. That's right. Well, that's why I've gone to so many vegetables because of not being able to chew meat well enough. So I couldn't puree meat for no way.
Sorry, Paige. I do have a couple more questions, but if you were going to go on, then I can save them for later as well.
We're just letting it simmer, so please
Okay.
ask.
Perfect. So there was a question earlier in the chat which talked about soy and having hypothyroidism, so having low thyroid function. Many of our patients get radiation to the neck. And so, estimates say 20 to 40% of patients may be hypothyroid, have low thyroid function up to a year or later beyond radiation. Janelle, do you recommend anything? If not, I'm happy to field that question as well.
I'm going to boot that one to you.
Okay, no problem. Yeah, so, it's a great point. So soy can actually affect the absorption of the thyroid hormone replacement. So the levothyroxine or the Synthroid, whatever medication you're taking. So the main thing is really timing. So, the recommendation is that you should avoid soy for a few hours before or after you're taking the thyroid medication. But beyond that, there isn't a specific restriction against taking soy. So another question on here is about antioxidants. Janelle, do you see patients, Janelle or Paige, do you guys see patients before they start their radiation or during radiation, or is it usually after treatment?
It depends when they get referred. So occasionally I will get patients. Occasionally I will get patients before they start treatment. It's rare.
Yeah.
Usually it's once they've already started. And then if they want to come back post, if they can't, or if they're having trouble eating or maintaining their weight, then I will see them afterwards as well.
Yeah. So they ask about antioxidants, during active therapy. So, at least for my teachings, the recommendation is to avoid antioxidants because radiation actually creates oxidative radicals. That's kind of how it destroys the cancer. So, doing the antioxidants could potentially work against you there.
Now, are you saying more the supplement? Because I always say no supplement, but you can eat the food.
Yeah. No, I'd agree with that. Perfect. All right. I'm sorry to interrupt there. Thanks for answering those questions, team.
Absolutely. Thank you, Dr. Goyal. That was a really important distinction you made there, Janelle, about the food versus the supplement. Because I think, as Kris said, when she didn't have an appetite. She just did milkshakes. But I know when I worked in the hospital, and now I get to play in my own kitchen. When I worked in the hospital, we always gave people those pre-made shakes. They can't always be delicious, but there's a time and a place for them. It's nice. But it's
In
important.
my world, you could add a made shake to a smoothie though and get the extra protein and the calories.
Absolutely. You can make it more palatable. You can customize it. And that's where,
Mhm.
that's why I love my job, is because we all have to eat, and we're all different. We all crave different things. We all have different relationships with food. So if we can kind of give people the tools they need to pick what works for them, whether that's milkshakes, whether that's adding the shake to a milkshake, whether that's making a soup and blending the veggies together, blending meat in there, however that works. That's the beauty.
That's what I think is so cool about the recipe that we're doing today is while there is a written recipe, each one of us will modify it to what we want it to be.
Absolutely. I'll be honest with you. I teach lots of classes with lots of written recipes. I tend to not follow them. Thinking I follow them. That's more of an exact science. But I also,
When I have a written one, I make my changes right out to the side. So I don't forget them because usually I do.
exactly. I teach a cancer and sickle cell support group where it's a wonderful group of people where we kind of just come, and I was making these more, I would say not complicated, but more labor intensive recipes. And one day an individual said, "Can you just make something easy? We just want to chat. We're going to make it how we want anyways." And I said, "You know what? You're right." So now we just kind of make a different cookie or make like something sweet or like a simple snack, because they're like, we don't have the energy for that. And that was an important reminder for me, because I might pick a recipe that takes an hour of prep, but you can prepare something that you love and is delicious in 5 minutes or less. This recipe wasn't a lot of labor. It's a little bit of time, but quick and easy, low energy.
So, Paige, I wanted to jump in real quick. I realized that you're cooking your soup, and this could be something that's very beneficial to folks who are going through treatment who often have low iron levels. So, while the food that we're making doesn't necessarily have a lot of iron in it, if you cook in a not the ceramic coated cast iron, but if you were to have a cast iron pot and make soup in it, you will get about 6 to 8 milligram. There you go. More iron in your food, especially if it contains vitamin C. So that will help leach the iron out of the cast iron and provide our patients with some extra iron, because we don't usually recommend the iron supplements.
I don't think I would have ever thought about that.
Yeah, it's great.
That's cool.
And it doesn't stick.
Right. Assuming it's seasoned appropriately.
Correct.
I know some people are scared of the maintenance, but honestly, sometimes I use some soap to clean it. I've had mine for a couple years, but the best part is you can sear something and then put it in the oven, right?
Yeah.
And pots can do that.
Yeah. And you can clean it with water and a metal scrubby. You're good to go.
Absolutely. Absolutely. They are a bit heavy. So sometimes they can be tricky. Like I know I have a big skillet. If I'm trying to pour something out of it, I need my husband to help me because it's pretty heavy, but they're very versatile. And again, with the iron, that's a really great way without, having to do handfuls of spinach or adding a supplement or something wild.
Or eating red meat, which doesn't seem to work for a lot of people.
Exactly.
Mm-hmm.
No, I have started to do something. Our daughter gave me this tip to salt if you're having like a steak, salt your steak on both sides, set it out for 4 or 5 hours. It's amazing how much more tender it is. It's like it ages it in your kitchen.
Gotcha.
Interesting.
Makes it a little bit easier to tolerate.
Mm-hmm.
That's good.
I would let mine rest for like 15 to 20 minutes. And sometimes that kind of allows the muscles to not tense back up, but it'll reabsorb the juice, which makes it have that in your mouth feel, which is what really I think that flavor. All right, folks. We have our soup here. It's reduced down to what I would say is my preference of texture. I'll go ahead and do a scoop into a bowl. Close up here. I think it reminds me of an applesauce. Out of an applesauce dish. You can see. Oops, sorry, we're giving you a facial, everyone. We're getting some steam on you. Now, obviously, the soup will be very hot because I just was simmering it for a while. But again, if you're serving this for a group or your family, and maybe this is not thin enough or thick enough for you, you can always serve yourself and kind of, I say, zhuzh up your own bowl, right? I like to say that in my house, where if I make something that's kind of like a general meal, I'll zhuzh up my own so that way I can add.
Mhm.
Say I want to add.
Ooh, look at that.
I like that texture.
Yes, this is beautiful. Now, I think this would be delicious with some toppings, but unfortunately my cupboards are pretty bare because I'm about to travel for the holidays. But I would maybe do some crumbled feta, maybe some, I think Kris said pine nuts. That sounded
Mhm.
good.
Don't burn them in that skillet, though.
You don't want to burn them. This is looking beautiful. I'm going to set it to the side and I'm going to grab my squash and see if it's done. I'm not sure. It could still need a little bit longer, but we'll pull it out and see if it's ready.
Paige, we have about 2 minutes left for our webinar.
Perfect.
And I did see another question here that maybe Janelle can help answer. So the question was about salt. Any suggestions to potentially, flavor if salt, if you're always tasting the taste of salt in your mouth after eating that.
Ooh, the combat the salt might be to add a little bit of sweet to things, maybe honey. Paige, you might have a better answer for that one to combat the salty flavor. I also would just purchase fresh and frozen things versus anything that's in a package, because they do add salt to almost all foods these days that are in packages.
Yeah, and that's a great point, is being mindful of what things already have a lot of salt in them, like this chicken broth. I sought out low sodium specifically because sometimes they can have 500 milligrams of sodium and you're not really tasting it. But some ways to cut that. Maybe you could try adding some acid if that's something you can tolerate. If you have mouth sores or some open sores in your mouth, acid might not always be the best, but that could probably cut that really intense salt flavor and maybe kind of shift to a sour note. Again, like I said, some sugar, maybe some honey or maple syrup. You could also lean on fat. Fat kind of helps cut the acidity. Sometimes if I oversalt a recipe, I might do a dollop of whipped cream or a dollop of whipped cream, oh my goodness, Greek yogurt, milk, coconut milk. Sometimes that can help mitigate the actual flavor. But in terms of the lingering, maybe have a peppermint or something afterwards if it's really lingering in the mouth.
I have also been known to go to, if I'm at a restaurant and they have meals that are way too salty, I've come home and I've taken, sounds strange, a handful of spinach, fresh spinach, and then when I eat it as a leftover, I microwave the spinach in it, and that just cuts the salt as well. It's very strange, but it works every time.
A great tip. I did see something in the chat here, just to clarify what an acid is. Vinegar or citrus would work for an acid. So something like red wine vinegar, apple cider vinegar, white vinegar, or whether you use lemon juice, lime juice, you could honestly maybe even try some orange juice, like fresh orange juice. And that's what I meant by acid. But yes, thank you, Janelle. That's a great tip. I'm not sure if we had any other questions from Dr. Goyal and for the Q&A.
I think we actually have most of the Q&A questions answered. So one question was about, supplements and kind of the role the supplements have. And I think we did address that earlier, just saying, in that period post-treatment, you really just have to get as many calories in as possible. And I think Janelle made some great points about how to add protein to your diet and add protein to some of these meals or soups. I'm going to take a look back, but if there's other comments that our panelists want to make, I'll look through the questions to see if there's anything else here.
And just an add-on to what you said is supplements. You mean like the protein shakes or drinks, that type of thing. But
Yeah,
just
meal
keeping in
replacements. Thank you.
right, the meal replacements. The other thing too is just knowing that while you're not eating as much, I'm just going to reiterate that like vitamin pills also sometimes have different herbs and things in it that you may not that may affect your treatment, so you do not want to take extra supplements without talking to your doctors first. It is best to get your nutrition and your vitamins and minerals through the food itself versus a vitamin pill or vitamin. Sometimes we will supplement vitamin D, of course, but we tend to do single nutrients that we know work versus a pill, like a multivitamin or different type of supplement that way.
All right. Well, I think we did answer all, if not just the majority of the questions that are listed here. Paige, any concluding thoughts? I mean, this soup looks amazing. Mine's still in the oven. My butternut squash is still in the oven, so it needs a couple more minutes.
I was gonna say for those cooking, they might still be in the oven, but I wanted to know, did you finish your soup? I know you might have roasted early.
I roasted early. It's in a blender that I haven't turned on yet. So I'll put it together after we're done. But
Great.
I've not had butternut squash before, so I'm looking forward to it.
Yay! Well, I hope you enjoy it. Just some final thoughts from me. I hope you all enjoy this soup. It was really such a pleasure to get to cook with you and get to chat with you. We put together a little cookbook with some other recipes that really lean on these fall seasonal flavors. So if the butternut squash isn't, your jam, there's some other things like a cranberry sauce and some mac and cheese with butternut in there as well. So a little something for everyone. But I did just want to thank everyone so much for cooking along with me and chatting with us.
It's
Paige,
been fun being with you guys.
yeah, Paige, Kris, Janelle, thank you all for serving on this panel. This is really interactive and I really enjoyed it. I can't wait to taste my soup as well. And also a special thanks to the Head and Neck Cancer Alliance and the American Head and Neck Society for their time and organizing and hosting this webinar. As a reminder to some people that had asked, we are going to be recording this webinar. It is recorded, so it will be available in the near future for those that weren't able to join or want to cook along in the future with the ingredients. Thanks, everyone. Have a good day and have a happy Thanksgiving.